Welcome to BMW Health Network, the leader in coordinated care throughout Bundesautobahn, with project team leaders Brandon, Marlena, and Wai-Yin.
Today, we share with you our thoughts on SMART goals and improvement strategies for the betterment of BMW, as well as plan for sustainability.
BMW Health Network delivers wide-ranging care, including preventive, emergency, specialty, and primary medicine. Our work spans urban and rural communities and brings together both independent and integrated providers with the joint goal of improving the quality, value, and coordination of care. Population health initiatives are a core component of our organizational structure. Improving processes across these targeted areas will allow us to improve the health of patients across our entire network.
In the pursuit of providing the ultimate caring experience, BMW Health Network will work tirelessly to bring our SMART goal to fruition, to improve the overall percentage of adequate control amongst patients between 18 to 85 diagnosed with hypertension to an overall percentage of 66.5%, or a 10.5% improvement from the previous 2-year average, by targeting medication adherence and lack of follow-up after initial prescription. We have found that both of these factors were key contributors to the overall failure in the rate of patients who did not have adequately controlled blood pressure in both the Medical Group and Berkeley Independent Practice Association. In light of this, BMW Health Network has committed to reorganization, with both the Berkeley Independent Practice Association and Medical Group under its direct control. Population health initiatives such as targeting medication adherence and follow-up after initial prescription will be implemented across BMW Health Network, with clinicians and coaching staff answering to both groups. The Berkeley Independent Practice Association and Medical Group will then report directly to BMW Health Network management. In order to facilitate a smooth transition and foster better patient care, BMW Health Network has also implemented a single electronic health records system across the network to monitor and track patients' therapy status. Over the next 2 years, both the Berkeley Independent Practice Association and Medical Group are expected to improve by 30% in each of these target areas following the implementation of our initiatives of push notifications, coordination of health information technology services, and medication counseling sessions with health coaches and nurse case managers. Better controlling these patients' hypertension will improve their overall health and quality of life, and will decrease healthcare costs associated with treating unmanaged chronic disease by giving clinicians the ability to track patient progress and adjust follow-ups accordingly. BMW Health Network will increase the percentage of adult patients with adequately controlled hypertension to 66.5% overall between Berkeley Independent Practice Association and Medical Group. By the end of year 1, Medical Group will be expected to improve to 69% adequate control of hypertension among their patients. This will be achieved through a centrally administered, coordinated process for managing medication adherence and prescription follow-up. By the end of year 2, Berkeley Independent Practice Association, following the example of Medical Group, will be expected to improve to 64% adequately controlled hypertension through increased medication adherence and increased follow-up after initial prescription. Success will be predicated on meeting or surpassing our annual targets and increasing the overall percentage of patients with adequately controlled hypertension from 56% to 66.5% overall, Medical Group patient percentages from 60 to 69%, and Berkeley Independent Practice Association patients percentages from 54 to 64%. In order to increase rates of medication adherence and rates of follow-up, BMW Health Network will need to enroll 50% of eligible patients in the push notification reminder system. By doing this, BMW Health Network will be able to identify trends, track patient data, and notify providers of non-adherence. Our goal is to increase patient satisfaction, increase patient understanding of medication administration, and increase ease of therapy maintenance. Integrating a patient-centered model of chronic disease care will improve BMW Health Network's financial status and reputation, attracting patients, providers, and insurance companies for future business in the interest of providing the ultimate caring experience.
Compelling evidence for our initiative is found in data presented here. Since our run chart data demonstrates fairly consistent trends, we have significant room for improvement. IMG performance is consistently better than IPA, but both groups can benefit from the performance improvement measures. Pareto analysis demonstrates the poorest categories of performance are patient medication non-adherence and no follow-up after initial prescription. Since the action of medication adherence and follow-up after initial prescription are both related to medication compliance, we are optimistic that our measures can improve both of these parameters. Our spread approach utilizes an early adopter approach by rolling out in waves. Due to the recent and ongoing EHR integration of the IPAs at BMW Health, we determined that it would be best to initiate the performance improvement plan for improved outcomes in our IMG sector. In effect, the IMG will be our due in a PDSA cycle. The IMG has long utilized the EHR, so the transition and readiness to participate in the initiatives will be more robust and less prone to technical difficulty or underutilization of the EHR. Furthermore, this initial rollout is part of this large PDSA cycle, with the IMG serving as the study group. Results will help us learn and finally act and implement what will be a challenging task in our more varied IPA offices. We know that positive results in the IMG will provide critical momentum at 15 to 20% adoption rate. BMW's successful IMG offices will further help to motivate IPA groups to engage in the process as critical process leaders start to improve perception of the innovation. We anticipate that following a one-year period working exclusively with IMG, the IPA offices will have achieved proficiency in the integrated EHR and will be able to implement these performance improvement measures. Readiness assessment has demonstrated that the executive group has strong willingness to engage in implementation. The IMG and IPA provider and staff readiness depends largely on our ability to provide them the resources and support for the program. The owners of this project are lead team implementation experts Brennan Sung, Marlena Smith-Milvan, and Wai-Yin Chan. BMW plans to rely heavily on the EHR to measure and document our outcomes, including continuing to utilize the run chart data to track our quarterly progress and the Pareto analysis to determine whether we are making improvements in the specific categories of action which we have targeted. We also plan to implement random surveys for patients, providers, and nurse practitioners on a quarterly basis. Lastly, we will meet regularly with the newest member of the team, the hypertension management coaching staff. This will help us determine whether the coaches have the resources needed to complete their goals and whether the workforce is adequately providing support needed to make the coaches' efforts more successful. Initial communication will be done via small groups based on each of the implementation teams, which is typically anchored by a medical doctor or a nurse practitioner. Retraining and reinforcement of measures will be likely provided on an ad hoc basis based on this feedback and the findings from the survey. Run chart data will be made openly available to all on the BMW Health Network and regularly revisited during interactions with team members. This transparency will allow patients to also recognize the importance of our measures and perhaps improve compliance, not only amongst employees, but patients as well. We feel strongly that the foundation in this performance improvement plan provides the seeds for sustainability. By making our data available publicly, we are implementing a level of transparency that patients and employees will hold themselves accountable for. The goals are attainable, but leave room for improvement. We feel that our provider teams will be motivated following this initiative to ask how they can do better in the other measures from the Pareto analysis, which we are not addressing at this time. We also know that this initiative will engender an admiration and level of internal competition in our other chronic disease management teams to find ways to improve their outcomes. Lastly, the plan for sustainability will be reinforced by our permanent in-house performance improvement team members, Brandon, Marlena, and Wai-Yin. As this project comes to a close, they will determine ways to collaboratively tackle the remaining measures in our Pareto analysis and also simultaneously address other population health initiatives, not just limited to our chronic disease management teams. Our executive team supports these measures because it is the best outcome for patients, but it has an additional benefit of financial solvency for our organization as we reduce the cost and burden of emergent but preventable care. We can do better not just for our patients, but also for our workforce, who can benefit greatly from improved profit margins and better compensation. BMW Health Network is constantly striving to be the ultimate caring experience. With each performance improvement initiative, we measure success in delivering the ultimate caring experience, not just in patient satisfaction, but in our ability to achieve excellent care outcomes and retain the best workforce in the community.